Hi, my name is Christina. This is my central line dressing change video. I'm going to start by verifying the physician's orders. I'm going to go ahead and gather all the supplies needed for this procedure, go into my patient's room, close her door for patient privacy. I'm going to go ahead and hand hygiene, introduce myself to the patient. Hey, Mr. Smith, my name's Christina. I'll be your nurse today. Today, we're going to verify your name and date of birth for me. And I would check his wristband for double verification. Perfect, Mr. Smith. Today, I am here to change your central line dressing. Do you have any questions for me? Okay, perfect. All right, so next we're going to go ahead and perform hand hygiene. First thing we want to do is grab a mask for both me and Mr. Smith. I'm going to put mine on first. Okay, Mr. Smith, we're going to go ahead and put a mask on you as well. I hope that's okay. Okay, perfect. If there's anybody else in the room, visitors or any other healthcare facility people, personnel, we'd go ahead and have them put a mask on as well. Or we'd ask them to turn their head away from the procedure site as a precaution to be sterile. I'd go ahead and perform hand hygiene. And I'd go ahead and put on my clean gloves. Okay. First thing I want to do is I want to go ahead and palpate around the insertion site just to see if there's any tenderness as well as any signs of any fluid. Okay. Then we want to go ahead and pull our dressing, stabilizing the catheter with our non-dominant hand. We want to go ahead and pull the dressing, the corners, and we want to pull those parallel with the skin. Okay, pulling parallel. You okay, Mr. Smith? All right, almost done. We want to make sure we pull away from the insertion site so that we don't pull the catheter out when we are finished. Okay, and then we're going to go ahead and toss our old dressing. All right, now we want to go ahead and inspect the insertion site. We want to look for any redness, any drainage, swelling, any discharge, or anything that is a sign of infection. We also want to inspect the surrounding area of the insertion, the skin. We also want to look for any redness, swelling, any rashes. We also at this time want to inspect the little catheter. We want to make sure there's no kinks in the tubing or any dislodgement, anything of that sort, before we put the new dressing on. All right, we're going to go ahead and remove our old gloves. And then we want to go ahead and perform hand hygiene. We'll toss these. Okay, now we're going to go ahead and grab our sterile dressing change kit. We want to open that away from us. We're going to go ahead and grab our sterile gloves out of here, only touching that 1-inch border, opening those up, going underneath the 1-inch border here. Okay, put on our first glove, making sure that that cuff rolls up on our wrist. Okay, 2 fingers under the other cuff. Again, making sure that it rolls up on our wrist. Okay, now we want to grab our chlorhexidine and our tweezers, and we want to crack it. Because we're using our chlorhexidine, we want to use a friction back and forth motion when using this for at least 30 seconds. We want to go ahead and grab that catheter with the tongs, and clean that. Again, 30 seconds. Back and forth. Okay. We also want to make sure we're cleaning the same size as the dressing when we're cleaning with the chlorhexidine. Okay. Also, we want to make sure that we clean the tubing as well. We want to clean the top and the bottom of the tubing. Okay. We want this to dry completely before we put anything, before we put on our new dressing. Okay. We're going to go ahead and toss these now that this is dry. In our trash can over there. We're going to go ahead and grab the new dressing and place it over the insertion site. Remove the backing. Place it over our insertion site. We want to remove the border, and when we remove the border, we want to make sure we initial it with our initials, date and time of dressing change. Okay, so we're going to write that info down. Okay, we're going to put that on the corner of our dressing here. Okay. We're going to go ahead and make sure everything looks good. We're going to remove our gloves, toss all our trash, collect all our supplies. Make sure Mr. Smith is in a position of comfort, bed's locked. We're going to go ahead and remove both of our gloves. Our masks. Mr. Smith, are you okay? Perfect. Okay, and then we are going to hand hygiene, and then we're going to go ahead and document our procedure.